Hi, everyone, and welcome to the special simulcast, the Neil Haley Show and the Ultimate Men's Movement with our host, Dr. Jack Rocco. Hey, Dr. Jack, very interesting, all the feedback you're getting from some of these podcast interviews, and it's great for me and you to be back talking to each other again.
Yeah, I kind of missed you there, Neil. We always have a good camaraderie, a good banter. So what are we talking about today, Neil? I know, you know.
Yeah, I know. It's basically about like a lot of things that are coming out there regarding Fauci and all. You kind of want to bring out things, right, in that
Yeah,
area.
and I have, both a professional as well as a personal investment in this topic. And, we'll start with the personal, I guess. Because I've seen a lot of guys. There's just a lot of reports out there about people having strange symptoms, strange conditions following the COVID. And I personally, my experience is, um, I had my Moderna shot. My first one was in January of, what was it, 21, correct? Is that when it came out? Yeah,
Yeah,
21.
2020. Yeah.
Yeah, 21. I got my first one in January, got my second one in February. Had some pain, didn't think much about it. I didn't have a choice. I'm not a real vaccine fan. I don't like a shot. I'm a guy. Um, but we were forced to, or not forced to, but if you don't get it, you don't have a job. So pretty much forced to. And so I got them, and then, I didn't think much of it. 2 months later, I was golfing with a friend, and day or two after that, my right knee swelled up pretty significantly, which isn't unusual for me because I've had three surgeries on that knee. So it's a part of what I live with, but I had been doing well for so long. So as the knee swelled. And as it developed, I told my PA, I'm like, this is weird. It just feels like my knee is going systemic, meaning my whole body started just feeling cruddy. Like, I just wasn't myself, little achy, little sicky. And then it advanced to, horrible hip pain, shoulder pain, just constant stiffness. And my kids were coming in at one point, and I did do a cortisone shot in my knee, which helped the knee. And then I went on a Medrol dose pack and didn't go, improved. And then as soon as I got off the 5-day dose, the symptoms came back, the knee, the joints, everything. Um, so then I was getting a little worried, so I went to family practice doc. I was working out of their office, and she's like, "Oh, you have PMR." And I'm like, "What is PMR?" And it's something we loosely deal with, but polymyalgia rheumatica. And it's basically a full body joint, one of the rheumatologic conditions. So she started me on full out steroid dose, and she was a tough woman. You know, she didn't give me much choice, and doctors are the worst patients, and I'm at the top of that tier. But I'm like, I don't really like steroids. She's like, Jack, you need it. Okay, so I started. Um, Helped, but not great. Long story, I went to a rheumatologist. He did like 16 tubes of blood, checked everything, and couldn't find anything. So eventually, I ended up being on steroids for about 10 months. And at some point following this, I was talking to a cardiologist friend, and I had heard through the grapevine that he was having some blood clot issues. He had a pulmonary embolism, he had a blood clot. And I said, "Are you okay, man? I heard you had some issues." And he's like, "Yeah, it's that damn vaccine." I said, "Vaccine?" I said, and he goes, "Yeah, the timing of it was perfect, and we're seeing a lot of that in the office." And I was like, "Wow, I was having some rheumatologic conditions." He's like, "Yeah, that's probably from the vaccine too." And sometimes it's hard with these things because we age, we're old athletes. There's things that, as a physician, I want proof, and generalized body aches, but these were severe. I couldn't shave my head. I was wincing I couldn't take off a t-shirt, put on a t-shirt. Even sleeping, I had to sleep with a pillow. I was sleeping on my back, which I hate because it didn't work either way. My shoulders, if I laid on this shoulder, it hurt. If this shoulder hung, it hurt. So it was pretty bad. But in the mornings, I couldn't lift my arms like this much. I couldn't push up off the bed to get out of bed in the morning. So I had to do this little squirm and log roll, get my feet off the bed and kind of, get started before I could go. And like I said, and then at some point I'm like, you know what? It could be the vaccine. I had a face drop at some point, and these are all symptoms that later became, affiliated with it. And we have a blood test called SED rate, erythrocyte sedimentation rate, SED rate. And in general, like 0 to 15 is the normal range. That's the normal amount of inflammation that you have in your body. So it's non-specific. It doesn't tell you what you had. It just shows that you have something. And so 15 is high normal. And we are always taught in medical school, orthopedics, that if you get to 100, that's something serious. That's like something life-threatening. That's metastatic cancer. That's a deep bone infection. These type of things that are, chronic, persistent, don't get better. And my level around that time was 86. So I was, that's the real deal. That's not just aging. That's not just aches and pains. Anyways, and I'm pretty much at this point convinced. So when all this stuff comes out about Fauci, and I don't want to label him as a bad guy, as a good guy,
Right.
as
Yeah.
everything is polarized, and I think no one lies on those extremes. I don't think he was an evil doctor intending to do these things. But what I think, I do agree that it was probably, and not probably, more likely was a accidental release or a planned release from the lab in Wuhan. Just the coincidence of it starting in Wuhan and they happen to have a virus in that lab that happens to be COVID-19. Um, Coincidence is too much. But the other thing, like people's reaction to it, was immediately unusual. Was something that, the way evolution works is in small incremental changes. You have virus one that becomes virus two with a couple little changes, and then a couple little changes to become three and four. But it's a slow, gradual thing. And, with this virus, the reason why it became such a worldwide epidemic, pandemic, was that no one had immunity to it. So the population will, as if things go normally and there's a certain population that will have an immunity. It's a slow immunity that you have immunity to one, so that gives you some cross reactivity to virus two, and so on. But this virus jumped generations. Evolution doesn't work like that. You don't go from animal A to animal Z without that evolutionary trail. So this virus immediately was something that no one in the world had been exposed to, and it was giving people symptoms and signs and deaths. And what the true rate is, I don't know. But it became clear to me early on, and I'm not a virologist, I'm not a, but just using those basic understandings that this is a leak from the lab, and this is a man-made virus because nothing else has ever been like it. When they were saying it came from bats in the lab, I'm like, come, I bought bats in the wet market or the food market, whatever. Um, I'm like, come on, that can't possibly be the case, and it spread, anyways. Now, Fauci's role in all this, I think there was, everyone in the medical field, family physicians were seeing a lot of it, intensivists were seeing a lot of it, and they were seeing reactions in the lungs which just had never happened before, just ridiculous
Right.
popcorn lungs and, crazy, patients. And, so something was definitely going on, and we were all suspicious of it. But then there was the party line, the political party line, the CDC, the FDA, the public response, and the public policies also were, they came out as extreme this, extreme that. And then they were constantly changing. Oh, you don't have to wear a you don't have to wear a mask. That's what
Yeah.
it said initially. But it's funny that they said that initially at a time when we didn't have masks. We hadn't prepared all our supplies, all our emergency supplies that we had in some storage facility were all outdated. We didn't have
Right.
we didn't have masks for the entire population. So the government policy was you don't need masks. And as soon as they started manufacturing masks, and then there was a surplus of masks, like, oh, you all need masks. You need to change your masks. You need the N95 masks, if you're doing surgery. Um, so it quickly went from an extreme of you don't need anyone, and then you need them all the time, you know. Um, the 6 foot rule, all of these things were just so obvious.
Right. And then you blame Fauci on this or not?
Well, he was the representative,
Right.
and I guess what I'm saying is that I don't blame him. I think in a lot of ways he's the Ponzi. He's the guy in that seat.
Yeah.
And, he's
You
well,
can even say Trump was the fall guy. He was the one that pushed the vaccine first. People don't talk about that. He
well,
was the first one that say, let's get a vaccine. Let's run it out. Let's roll it out as quickly as possible with no, uh,
but do you think that Trump made that decision himself, or do you think Trump was advised that
no,
that's
this is Trump was the one that was one of the big pushes for the vaccine right
right?
off the bat. But again,
Yeah,
I don't think he was the design of it. It was not the type of vaccine. They should have went for a live vaccine, in my opinion, that it would have done way better. That was really the COVID versus how they built this and developed this, because and that in itself was a problem. And when we ever come up with a good vaccine for it, who knows?
Right. But whatever my opinion is on it or your opinion on it is on it, we don't know. I guess my point is that everyone had a lot of we don't knows. We've never seen this before. This has never
Right.
happened. There's a lot of we don't knows, but the politicians were coming out with, yes, this is what you need. This is what you need. This is what you must do. And then Fauci's like, if you don't get vaccine, you're not going to work at Amazon, you're not going to work at Google. We're going to get all these big companies on. And, and he had some ridiculous quote was like, you know, people will abandon their ideological bullshit once we mandate or their job or career is on the line. So there were businesses that closed. I mean, people's livelihood was really affected.
And
And
Europe's really never recovered from this. Thank
no,
goodness that they have not.
yeah. I mean, we all know that, there was an Italian restaurant outside of Charlotte that I'd been taking my son to since he was in diapers, you know, and, my kids were down there and like, hey, let's go to that restaurant that we've been going for the last 15 years, closed, papered off, so many good businesses, so many families and livelihoods were affected by these policies that were so black and white based on a virus that was mostly gray as far as I knew.
Yeah, no
So
doubt.
how do you close businesses, you ruin people's lives on this gray virus that we don't really know what's going on with a black and white rule that no, you can't open. But funny how liquor stores were considered essential, but you can't have people in your family restaurant. McDonald's was considered essential, and some of these other fast food places.
But not that. Yeah.
So
So do you think Fauci had the decisions of those? That's the point.
I think he's a mouthpiece. I think he probably had a contribution to it. I think there are things that he knew that we don't know. And this is the gray zone. What did he know and what didn't he know? Um, we're never going to know. He took the fifth. He didn't answer the questions, which prior he said, I've got nothing to hide. But, just being in that position, having served in the military and understanding government organizations,
Right.
want to come out with, what's the corporate byline? What is the corporate word? What is the message that we want to put out? And you put that message out with absolute authority and absolute certainty, whether you're certain and absolute about it or not.
Right.
And
Are you upset with Fauci yourself based what you went through?
yes,
Okay.
but I think if the way government works as well, had Fauci taken a stand and opposed these policies, he would have been gone. Some other lackey would have been put in that
Because a lot of the restrictions were after Trump left office.
right. But like I said, I think if Fauci had given any resistance, he would have been booted. He would have been like, he would have been made an alien, he would have been made, public enemy number one. Fauci had, well, who knows what, he had a drunk driving episode 4 months ago, 12 years ago. You know what I mean? Something would have come out.
So
We
when you're
could have
hearing
just,
that COVID's back rolling on a rise again, what do you say? Come on now. We just deal with it, go through it, and that's it.
yeah, I think it's a cold at this point. But then you get into all the conspiracies of what was the virus really doing? Did it change our genetics? Are you permanently afflicted and permanently under control by the government and susceptible to waves? Or I don't know. But the fact that there are so many conspiracy theories about it, and we haven't gained any clarity on it, despite being 5, 6 years later. There's no increased clarity. There's more confusion with it. Who made it? Was it released? Was it and then the idea of ivermectin, the
Ivermectin, yeah.
ivermectin, and apparently, in order for them to get the authority to issue an emergent vaccine, there needs to be no other treatment available. So, had they said that, yeah, ivermectin works, you can take ivermectin, it's got a 40, 30, 70% success rate. If they had said that there is something available, and apparently there's stacks of documents that say it was effective to a certain degree, but if they completely discredit it, so they could release the vaccine. So was this a way to, pay your buddies at the big pharma companies, for developing something the government needed but couldn't
So
really,
these are things we'll never know, except
well,
you,
we may
except
at some point, but
never know.
don't know now.
Yeah.
But yeah, but I think the fact that they use science, I think these are, and I think you can extrapolate a lot of what happened with the vaccine to what's currently going on in healthcare. Because we deal with this on a day-to-day basis. There's things that, I believe are healthy that Dr. So-and-so believes are healthy, but if you talk about them in the office and you don't give the standard protocols, the
Yeah.
standard.
If the FDA's not approved it, even if it works, too bad, so sad.
You're right, but they'll demonize you. They'll put your name in the paper. Dr.
100%.
Rocco was fired for using whatever, which was off label, and so the power of the government to manipulate medicine, I think, is out of control. And we always talk about the separation of state and religion. Um, I think the separation of state and medicine should also be included in that. There should be, physician panels, scientists, experts who make recommendations, not something tied to red state, blue state, red,
Or
blue state, blue
big
person,
pharma,
big pharma, right?
which is the biggest fight ever. Okay. Well, that's great to hear your perspective. My perspective to finish off this podcast is, whatever we say about Fauci, whatever we say about this experience, it's a life-changing experience that hopefully we will not make that same mistake again in history. When we have another pandemic, we handle things differently. We don't handle things the way we did. We don't close things. We build herd immunity, and it just happens that people might have to die.
I agree. That's a great bottom line. I think you nailed it, Neil. Um,
I
but
mean,
like,
I hate to say that, but are you going to let the amount of people hurt by COVID emotionally, mentally, the vaccine, all of these are more deaths than just keeping everything open and doing herd immunity.
yeah. But it was such a slow, it was like that, you put a frog in water on the stove and he won't jump out because the heat just rises
Yeah.
so slowly. I think we were all caught up in that. It all started, we're like, oh, this is kind of fun. I've never experienced a pandemic.
Right.
We have to stay home. We can't do. So I said at first, we all got to watch Tiger King and whatnot,
Exactly. But then we got
so,
tired of it, and Clubhouse
oh
was
my
fun at
God,
one
tired of
point,
it.
and
Then
all
it
these
became
things.
like
Yeah. Yeah.
unbearable.
Exactly.
But
All
at,
right.
but at that point, the water was already too hot.
So going to theultimatemensclinic.com in New Bedford, Massachusetts, you can check out Dr. Jack. But also, if you're looking for any type of help when it comes to men's health, he's available for you anywhere in the country, right? That's the cool thing. You can work with them
Correct. We
with
have
the testosterone replacement therapy, have the conversations. People are traveling all over the country to see Dr. Jack. So check him out today. Appreciate it, Dr. Jack. That was a lot of fun. Good
Thank you, Neil. I
conversation.
appreciate it
All
all.
right. That was a special simulcast. Neil.